Go ahead. Go ahead, sir.
Uh, a very good afternoon to all of you. And today, with the Facebook Live session, we are going to discuss about how to improve the success of IUI or the intrauterine insemination. And well, at the beginning, I must tell that there are different treatment we follow to treat the infertile couple, and out of that the most common one what we follow is the fertility awareness based method, that is also known as FABM. And in that process usually we give counseling and suggestions to the patients regarding the fertile period and all. And when they fail with this method, the next step we go to by giving them some medications, that is known as ovulation or ovulation inducing agents. And with the use of ovulation inducing agents, usually we ask them to follow. Usually, that is the time when the female is supposed to be fertile. Usually, in a female who is having a regular normal menstrual cycle of duration 28 to 30 days interval between two menstrual cycles, usually their ovulation occurs around day 14. So sometimes this ovulation can also occur a few days before and for few days after that day 14. So usually we advise them to have regular intercourse during that period, which is the fertile period. So that entire process or entire treatment modalities is known as OITI, or ovulation induction with time intercourse. And when these females are failed to conceive, even after this method, that is OITI, the next step what we follow is known as IUI, that is known as intrauterine insemination. So I will discuss in details what is this intrauterine insemination, and how we can improve this. So I'll mostly tell the tips for the patients, although we have so many tips and tricks so far as the medical practice is concerned. And the last step, when still they fail to achieve their pregnancy after few cycles of IUI, then we go to the test tube baby methods, or also known as in vitro fertilization or ICSI. Well, as you can see in this table, that if we're expecting that how much is the success rate in a type of treatment, what we are providing to our infertile couple, then if we'll see in particular about IUI, only 13 to 19% of the couples can achieve their pregnancy in a single cycle of IUI. So it is never 100% or never a big numerical in percentage wise. So always we should know the limitations, that even if you are using IUI as a technique of treatment for infertility, the success rate has its own limitations. And keeping it in mind, usually we give counseling to our patients so that they should understand the treatment and they should accept it. So moving to the next slide, if I'll before telling you details about that where we should proceed for IUI and how we should proceed, I must tell that there are many factors which favors the success of IUI. And out of that, especially younger individuals, especially the female, the wife, if she is younger enough or having a age group between below 30 or even below 35, the success rate is quite good. But as the age of the female increases, because the oocytes become mature and their age also decreases. And also in a younger population or young female, the ovarian reserve, the number of oocytes which are reserved in the ovary, which are capable of ovulation and causing pregnancy, is good. So the in a young age female, the ovarian reserve is good, and also the endometrium should be good and it should be receptive. It should not have any disease, and the female genital organs like the uterus should be a normal one without any pathology, without any and without like any tumors or any septum should not be there. and also the tubes, the fallopian tubes, which brings the oocytes released from the ovary inside the uterine cavity should be patent, means the passage should be intact so that the oocyte can come inside the uterine cavity. And at the same time, the semen parameters that usually we are using in IUI should also be good. That means the count, the motility, the morphology, and so many other common using should be good enough. Similarly, there are some factors which leads to failure of IUI. That means if such things are present in the couple or in the female especially, we should not try, or we should discourage to undergo intrauterine insemination. Suppose she still having an ovulation. Usually, in case of anovulatory disorders, we try to give ovulating induction agents or ovulants to cause ovulation. But still, if we find that this is not ovulating and there is some meaning of going for this procedure, and at the same time, if the tubes are blocked, at least one tube is required to have pregnancy. But if both the tubes are blocked, or having hydrosalpinx or any kind of pathology which prevents the means movement of the gametes inside it, so that should be discouraged. Similarly, already I told, is if there is uterine anatomical abnormalities like septate uterus, or there is tumors encroaching the endometrial cavity and all, so we should not perform this procedure. And some hormonal factors like some thyroid disorders, prolactin disorders, also the sperm and oocyte factors already we have discussed in the previous class. And if we'll see what are the indications of intrauterine insemination, then we must visualize that what are the indications in a female and what are the indications in the male. So far as the female is concerned, the indications for IUI are if there are some congestion of septum, or if there is incomplete septum in the vagina where the intercourse is not incomplete, or there are some problem in the cervix, or there is damage to the cervix, part of the cervix, so the cervical glands are unable to secrete cervical fluid, through which the capacitation is not possible, or it is the mucus of the cervical is having some antibodies or two anti-sperm antibodies which is damaging the sperms passing through it. So that if you are using IUI, we are bypassing these structures and we are putting the processed semen inside the uterine cavity, so that into the tubes, the oocytes coming and getting glands in the ankle region of the tube, where the pregnancy is occurring. So these factors in the female. Along with that, the immunological factors I have described, that there are some anti-sperm antibodies which are usually present in the female body, and if they are collected or they are being secreted in the cervical canal, into the cervical secretion, through which the sperms pass and they get damaged. Similarly, some sexual dysfunction like vaginismus, and due to this sexual dysfunctions, he is unable to have a regular intercourse. That's why he is unable to have pregnancy. So if you are using IUI as a method, means we are bypassing the sexual intercourse, and that's why he can get pregnancy. And there are also some conditions like endometriosis, where the endometrium or the endometrial glands are being means present outside the uterine cavity, either in the peritoneum or deposited over the tubes or on the ovary, where they produce the chocolate cyst like conditions, thereby preventing the oocytes entry into the tubes, or they damages the oocytes after its release. And these toxins produced by the endometriosis is also detrimental for the growth of the fertilized ovum, fertilized embryo inside the uterine cavity. It affects the implantation and so on. So such situations also we should avoid. We can also have the pregnancy by methods called IUI. And so also unexplained infertility. So unexplained infertility are the conditions where the actual cause of infertility is not known, and both male and female partners have been evaluated, but we have not found any reason for the infertility. So in such situations also we can follow the procedure of IUI. Similarly, there are some male factors, so here we can consider IUI. like the anatomical defects of the penis. That is, sometimes we know the condition like hypospadias, where the opening in the penis is under the dorsum, under surface of the dorsum of the penis, so that the ejaculate cannot be deposited inside the vagina or into the vaginal deep into the vagina, or there are some erectile dysfunction or ejaculated dysfunction like retrograde ejaculation, where the ejaculate goes into the urinary bladder, or there is erectile dysfunction where he is unable to have the copulation or the intercourse. So those are the conditions where if you are collecting the semen, then we can process them and we can inject or we can put it into inside the uterine cavity, thereby allowing a natural process of conception. And similarly, if there is excess or deficit semen volume, because to have pregnancy in a normal intercourse, a particular volume of semen needs to be deposited in the vagina. If the volume is less than 1.4 ml, then also she cannot become pregnant. And if the volume of the semen is too much, the volume is more, but the concentration decreases, and that also leads to infertility. Similarly, the semen liquefaction time. Usually, the semen should be liquefied in 30 minutes. And if the liquefaction time takes longer, thereby the sperms inside it gets damaged and they cannot be released into the cervical canal and they cannot ascend up to the uterine cavity. Similarly, if there is male subfertility in the form of oligoastheno or teratogenic spermia, that's why it is called. And such patients, what we do, we process the semen sample and we just strain out the more highly motile and the healthy fraction of these semen of the sperms and make them concentrated, and some reagents are being added to it and it is being put into the uterine cavity. So that is how we overcome all these difficulties which lead to the failure of pregnancy. Now coming to some of the indications of IUI donor. There are some conditions the perform by using the semen of a donor, mostly a healthy donor, with it's some list of criteria to be fulfilled for that. And this IUI donor is required in some males. They have some issues or some problems or diseases in their genital organs, and for which the semen number is absent, the sperms are absent in the semen, or they have a very deficient quantity or some genetic disease. And pregnancy can be performed by taking another person's semen. And these are the conditions where we should perform the IUI donor. Like if there is sterility due to some disease, the testis has been damaged or removed, if there is a vasectomy, or if there is archirectomy, or there is radiation exposure, that's why the testes are damaged. If there is some kind of sexual or ejaculatory dysfunction, like sexual dysfunction means he is unable to have intercourse, that is also another point where the ejaculation is also not performed. If there are some genetic diseases in the husband, that's why there is a chance or risk being transmitted to the offspring, thereby they can take the semen of a healthy donor. Severe RH incompatibility also. If there is chance of severe RH incompatibility due to the blood group in the husband and wife, where we can take the donor semen, which we can bypass this incompatibility issue. Similarly, in couples who cannot afford TISA and ICSI, because some of the conditions, as I described above, where we can take the sperms from the testes of the husband by special surgical technique, and then we can perform ICSI, intracranial sperm injection. That is a method of test tube AV. So if they cannot afford, because these are expensive techniques, yes, and if they cannot afford, then they can go for IUI donor. Similarly, if she's a single woman and all lesbian also, if the law allows, and they can use the donor sperm and they can have their own child. Well, after knowing that when and how, where we should perform IUI, we should know that how the success of IUI is measured. What are the principles that we should follow so that we can have a successful IUI? Like IUI can be considered if there is mild or normal male factor. That means the specimen count, the sperm count in the semen should be more than 16 million for ml, or the total count should be more than 39 million, and the motility should be at least 30% and above, and the morphology should be more than 4%, and the volume of the parameter. So if any of these parameters are compromised to a certain degree, that is called mild. But if it is profoundly compromised, that is if the semen, the sperm count is less than 5 million per ml, then it is called moderate to severe male factor. So such situations we should not use IUI, but in case of mild and normal male factor, we can use this process. And similarly, if there is any ovulatory dysfunction whereby giving medications, she is not having the ovulation. So in that also, by giving medications for ovulation, we can perform the IUI. If either partner is having any kind of sexual dysfunction, as we have already discussed, if there are some immunological factors like circulator, anti-sperm antibodies, and if there is an unexplained infertility also. And similarly, we should avoid IUI if there is severe male factor abnormalities, as I already discussed, and if there is grade 3 or grade 4 endometriosis, there you should also avoid. And if there is bilateral tubal block and a poor ovarian reserve, as the age of the female is advanced above 35, or especially above 40 years age group, where the ovarian reserve has been assessed and it is found to be very poor or low, better we should avoid IUI. Well, while performing the IUI, the first step is we are using some form of ovulogens known as gonadotropins. Either we use letrozole or clomiphene citrate or some gonadotropins in the form of FSH or HMG, which is usually given as injections or tablets to the females, mostly from just 3 of their menstrual cycle. And the growth of the dominant follicle or the growing follicle is being monitored by ultrasound, mostly transvaginal ultrasound, and the serial growth is being observed and recorded. And when the size of these follicles become adequate for rupture, usually you give a trigger. So after giving the trigger, usually within 24 to 36 hours or 32 to 36 hours, we perform the procedure called IUI. So whether we should go for the use of letrozole or clomiphene citrate or gonadotropins is a matter of question. So there are so many mentioned here that they have given reasons, and they have given evidence that which drugs we should use and which is superior to what. So as I have already told, either we use clomiphene citrate or we use letrozole or we use gonadotropins. But gonadotropins are always found to be improve the cumulative live birth or pregnancy rate as compared to that of the clomiphene citrate or the letrozole, but it is expensive. So usually this is used for IVF and all, but here if you are using it, it increases the cost. The chance of more number of follicles being leading to means multiple pregnancy like twin or triplet. And similarly, if you are comparing this clomiphene citrate and the letrozole, which are oral forms, usually you don't find much difference. So usually we individualize the type of drug what we wish to use, in which conditions we wish to use. So that is being individualized, and that is the decision of the doctor. Now coming to the monitoring of the cycle, usually after giving the medicines like letrozole or clomiphene citrate or gonadotropins, we need to monitor the growth of the follicles in the ovary. Usually we do perform a baseline transvaginal ultrasound on day 2 of the menstrual cycle to rule out if at all there is any ovarian cyst, and what is the thickness of the endometrium, if whether there is endometrial hyperplasia, if what are the number of antral follicles present in both the ovaries. So after assessing that, usually we go for serial ultrasound monitoring, and which is being started ideally from day 9 or day 10, where we see the endometrium and growth of the follicles, as I have already mentioned. Usually the growth of the follicles is expected at a rate of 2 millimeter per day. And once the size of the dominant follicle, means large size follicle, they reach either 20 mm if you are using clomiphene citrate, or 18 mm if you are using HMG, then we give a trigger. Trigger means we give a injection or medicine where it will help in the rupture of the follicle when we can perform the IUI. So that is being followed, and the endometrial thickness in ultrasound should be at least 8 millimeters. That once we give the trigger means an injection, once the size of the dominant follicle of the egg become 18 or 20 mm, we give a trigger injection. After giving the trigger injection, after some hours, we perform the IUI. Then how many hours of gap it should be, whether it should be 32 to 36 hours or it should be 42 hours. So there are different opinions by different researchers, but finally the recommendations are, if we do, if you are doing, if you as being suggested by SRE Capri workshop, if you are giving a trigger injection having 2 to 36 hours after the trigger, then the success of the IUI is maximum. There are the different steps. Then we should understand what are the steps of performing the IUI. Once we have started the IUI process, we have given the medications, we have assessed the increased size of the follicles, then we have given the trigger for rupture of the follicle. Then we should do the process of the IUI. Then the steps of the IUI, which includes, first step is the semen collection. Usually, the husband is asked to produce or collect his semen by the site of he's collecting it at home. Then he should produce the sample maximum within 30 minutes to 1 hour at the lab, so that it can be processed, it can be washed, and it can be prepared so that highly motile and morphologically normal sperms are being separated from the entire semen sample. Then either it can be done, the color semen process either we can be done by direct washing or swim up technique, or another technique called density gradient technique. And once this semen sample is being processed and the motile fraction is being collected, then it is the some amount of it, around zero point 0.3 to zero point 0.5 ml of it, is being inseminated or being injected inside the uterine cavity. So this is how the semen is being processed in the test tube, and through density gradient or swim up technique, this is being separated. The highly motile fraction of this semen is being separated from the rest of it. Then it is being pushed inside a special catheter where it is being pushed inside the uterine cavity. Then which technique of semen preparation should we use, that whether we should go for a swim off or a density gradient technique? So again, this depends on the what is the type of semen sample. If the type of semen sample is little having some mild abnormality, then better we should go for density gradient technique. But if it is a good sample, then we can also go for swim off. But researchers or the evidence tells that we can use either density gradient or this swim off technique, and there is not in the successful outcome. But usually in our practice, we individualize, and we try to perform either density gradient in cases of mild or abnormal semen parameters, and swim up technique in case of normal semen parameters. And well, after processing the semen and separating the highly motile fraction of it, usually we do the insemination by using a special catheter, and that catheter is either a soft catheter or a rigid catheter. But some people prefer rigid because it helps in a easy entry into the cavity, and some people use soft catheter. But the type of use of catheter does not influence the clinical pregnancy rate. Remember that it depends on the doctor's choice which catheter they want to use. Usually, after the performing the IUI, while performing the IUI, we may face some difficulties, like difficulty in introducing the catheter inside the uterine cavity. That's why we ask the female that you fill your bladder, the full bladder, so that the uterus and the cervical lining becomes straight enough, and so that we can push the sample easily through the channel, so it will not cause any difficulty to us. And usually that's why we ask them to come prepared, and it's just a OPD take procedure. It does not involve much pain, little bit of discomfort. They should come prepared with their parts being prepared and cleaned, so that we are not using any kind of antiseptics or any cleaning agents while putting this IUI, means insemination, doing this insemination process. But we do it in a environment where we use all sterile drapes and instruments, and of course the semen is being processed in all the precautions to avoid infection or any kind of contamination. Then after exposing the cervix, usually we try to use these catheters which are very small in diameter, which enters easily into the uterine cavity. But if at all it fails to inside the enter into the inside uterine cavity due to antiversion or retroversion, usually host by an instrument called valsalem and given a traction, then it becomes straight. The passage becomes straight so that we can easily push it. So this is how we overcome some difficulties, and we expect that our patients they should also understand some of the things so that they can also cooperate while performing this procedure. Similarly, the status of motile sperm count is also very important, though it is more important for the doctors to understand. But also, people should know that at least 2 to 5 million of total motile count sperms would be available in the semen sample which we are inseminating, so that if the initial concentration is at least 10 million and above, then that gives to a good sample after process, and which helps in a good pregnancy. If the final inseminatic count is less than 1 million total count what we are infusing because of the loose semen sperm density in the initial sample or in the parent semen sample, then the pregnancy becomes unsuccessful. Then once we perform this IUI, usually if he pregnancy, then whether we should go for a next IUI cycle or not? Yes, because as I already told that in a single cycle of IUI, the success may vary between 13 to 19%. So if they fail to have pregnancy in one IUI cycle, we should encourage them. If there it is indicated enough, then they should at least undergo few cycles of IUI. Then how many cycles, whether it is 3 or 4 or 6, again that we also decide as per the evidence-based recommendations. And it has been seen that women says at least 3 and maximum 6 IUI cycles can be used for. And studies have reported that there should not be any significant there is no significant increase in the clinical pregnancy rate if you are doing IUI beyond 4 cycles. So better we should limit it to 4 cycles. Then while performing the IUI, either we can go for a single IUI or a double IUI. But more majority of the cases we usually follow single IUI because it has been seen that even if you are performing double IUI, it does not increase the success rate much, so that it just only increases the cost for the patient. So that of course depends on the doctor side, but also if the follicle is not ruptured and we are waiting for the rupture of the follicle, etc. And sometimes we are also using ultrasound guided IVF where we can ensure that the tip of the inseminating catheter is inside the uterine cavity, so that USG guided IVF yields a better success rate. So if you are using ultrasound guided insemination, that is a good thing to do. Similarly, what we do, we usually after doing this IUI, we suggest to lie down or sleep for some time. But this sleeping period is only limited to 15 minutes. It is not required to sleep, followed by the procedure to sleep for hours, or take rest for days, followed by the procedure once they go home. These are not at all required, but only recommended is at least 15 minutes. Although some studies or RCTs which support a rest for 15 minutes, and some studies also does not really support. But but allowing her sleep for 15 minutes will not cost anything. It is of nature, it has some potential benefits, and high quality studies have proved that. So better take some rest, but for 15 to 20 minutes. But definitely she need not to be immobilized, or her day-to-day activity should not be affected, and she should take it as a normal process, so that and she should remain relaxed so that she can achieve a good pregnancy rate. Still there are some tips and tricks for us for the dog means mostly we follow that, but patients need to know that if they are having a shorter ejaculatory interval, means the IUI should be followed at least 2 to 3 days prior to the process. If the ejaculatory gap is very long, that is more than 6 days, 7 days and more, the sperms in a long gap ejaculatory sample is usually damaged, having lot of deformed sperms. So also very less gap between the ejaculatory sample being submitted for IUI, that less than 2 days, there is chance of more of less concentration of the sperms and more of immature forms. And that's why if the gap is between 2 to 3 days, then the IUI should be followed. the successes has been found. Similarly, the semen should be processed within 60 minutes after being collected. Means ideally he should produce the semen sample by the side of the laboratory, and as soon as possible it should be inseminated. But if the time gap is more than 60 minutes by the time he has collected and it is being processed, by the time because they are highly thermal sensitive, they gets damaged, and that's why the sample becomes defective. Similarly, if you are already processed and washed the semen and it is the sample which is being inseminated is already damaged, then we should not wait for more than 2 to 3 hours. And the best time within which the insemination should be done after the washing of this sperm or the process of this semen is 90 minutes. So by keeping it after process for a longer time is detrimental for the health of the sperm, and thereby the sperms are damaged, and it will causes decreased fertility rate or a less chance of getting pregnancy. There are some conditions, even if we have planned for a IUI, we have still we have to cancel the process, especially when we find that in the ultrasound the number of follicles growing in the ovary is more than means the size is more than 20 and the numbers are 4 or more. In such situations we should cancel it. Some researchers also give an advice that if more than 4 follicle size more than 14 even mm 14 then also we should cancel the cycle, because by giving a trigger in such cases it will cause, there is high chance of causing ovarian hyperstimulation syndrome, where there occurs accumulation of water inside the various parts of the body, and therefore it causes problems in the respiration, in the heart function, and generalized function of the person, of the female, and there is a chance of multifetal pregnancy. So avoid these complications. Usually we abandon such cycles or we cancel such cycles. Well, we have processed the semen, we have prepared her for IUI, we have performed the IUI, now she has to go home. But whether we should give some medicines? Yes, usually we prefer to give some medicine in the form of luteal, so we give some progesterone derivatives, either micronized progesterone or dydrogesterone. But there are still people, some doctors favor the use, some doctors don't favor the use. But I will show you some of the evidence whether we should use or not. Yes, majority of the cases we use it, but if use when we using gonadotropins as an ovulation or ovulation inducing agent, we definitely use this luteal phase support. But if you are using clomfencitrin and clomfencitrin or letrozole, usually use means if the actual exact benefit is doubtful, even if you are using, but benefit of doubt, usually we use some kind of progesterone support after IUI. But if you have used gonadotropin, definitely you follow this process. So at the end, I must say that though IUI is a kind of artificially protected technology that usually we use for our patients who are suffering from infertility, but it is a simple technique. But it requires the involvement of both the doctor and the patient, because it involves some indications or some recommendations that usually we follow, and we try to convince the patients. They should also understand that whether they should wish for this procedure, and before taking their own decision they should take the suggestion of the doctor. And that's why I wanted that they should know some of the intricacies, some of the scientific aspect of the IUI, so that if even if they are planning to do it, they should understand the correct or not. So at the end, I must say, the longer you wait for something, the more you appreciate it when you get it, because anything worth having is definitely worth waiting. Thank you very much. Hope you people have got some idea about some of the tips that I have discussed with you about IUI. So if you have any question, then please let me know. Thank you. Hello.
Sir, we have some questions.
Hello.